overview of what we're going to talk about. So I'll take it that even if you have experience with hypnosis, I'm going to assume that there's no knowledge about it for people who've never ever used hypnosis before. And then we'll look at the clinical relevance of hypnotherapy for migraines and migraine case studies and how hypnotherapy works with migraine sufferers. Then if we go to the next slide there. So I think a lot of people have a few misconceptions about hypnotherapy, but hypnotherapy is a very gentle way of accessing your subconscious mind, and that is where all the power lies. So the most common analogy used to explain hypnosis is when we're driving, and if you've ever driven a long journey, say from Dublin to Galway along the back roads, you might notice that part of the way there, you might think to yourself, well, did I go through that town or that village? When you know you have, but the reality is you've been in trance most of the time. So it's a very safe state, because if somebody or something went out in front of the car, you'd put your foot on the brake straight away. So in trance, we're always completely in control. And the point of hypnosis is to access the subconscious mind. Now, it can be seen as a state as well, an altered state of consciousness, but it is a tool to access that really powerful part of our mind where we can change belief systems, and the belief systems will in turn change our behaviors, which in turn can have a very positive effect on quality of life. So on the next slide, we have misconceptions about hypnosis. And a lot of people will think, if they've never used hypnosis before, or if they're used to going to stage shows, they might think, well, that person on stage doesn't seem to have any control, but we do. When we're in trance, we are completely aware of what's going on around us. And you can come out of trance anytime that you want. So if a hypnotist said to you that something you didn't want to accept, you would simply reject it. And we know that there's a phrase we use in hypnosis called a hidden observer. And it's almost like a little security guard watching all the time to see if the suggestions are congruent with what we want. So that makes it very safe. And if somebody said something to you you didn't want, you'd simply reject it, or you'd come out of trance and reject it then. You won't be asleep in trance. It is a very relaxed state a lot of the time, but actually you don't have to be relaxed. So even on stage, you'll see people are not very relaxed either. They're up thinking they're Diana Ross or they're Superman or whatever it is. I suppose some people are afraid they'll tell all their secrets. You won't, because again, you're completely in control. And you can give amnesic suggestions in trance. And sometimes that's useful and sometimes it's not. So in a one-on-one session, you'd rarely give amnesic suggestions. It wouldn't be relevant most of the time. The other thing is that you're completely aware all the time. It's almost like a higher level of consciousness. So you will come back out of trance when somebody counts you back up at the end of the session, or when you really want to come back out of trance. We'll move on to the next one there, Deirdre. Thank you. And I guess because it's an old therapy, but it raises a lot of questions. Is it useful? Is it effective? Is it all a myth? Is there any credibility behind it? And we'll see now in the next few slides that there is a huge amount of studies that would support they would support the efficacy and show the efficacy of hypnosis for migraines, as well as other types of pain. And more recently, we'll see there's MRI scans and lots of studies which really are looking into the physiology rather than the experience of hypnosis and the pre and post results. So, which I find quite interesting. So in the next slide there, we'll have a look at, this was a study done. It was a meta-analysis actually, and it showed that hypnotic analgesia was an effective means for reducing pain with 75% of patients, which is a considerable amount. So will it reduce pain for everybody? No. Will it reduce it for a lot of people? Absolutely. And these patients were clinical patients, and there was experimental pain where they might, you'd be in a, where you've no actual physical pain, but they'll inflict pain on you in the trial. And that's the experimental pain. A lot of the studies really do involve people with migraines or with some kind of back pain or any kind of pain, really. So there was a mixture of across all those studies. And when they looked at that overall, it was a significant improvement in pain relief. And another study there, this was for children aged 6 to 12, and they had classic migraine, so migraine with aura, 28 in the study. And I thought it was quite an interesting study because for 3 months, one group took a beta blocker, another group took a placebo, and then there was a crossover. So they both got experience of each. And afterwards, they found that they measured, obviously, the number of migraines that the children had. And you can see for yourself on the slide there, 5.8 migraines. I know that's not possible, but when you average it out, they had on average 5.8 migraines with self-hypnosis, and 14.9 with the beta blockers and 13.3 with the placebo. So quite a considerable difference. And people tend to like hypnosis because it's gentle and it puts the person very much in control of their own pain relief as well, and pain duration and pain intensity, which when we're working with people with migraines, really what you're looking at helping somebody with is quality of life, helping with reducing headache disability, reducing the severity of the migraine, the duration of the migraine and the frequency. And on the next slide then, this was a meta-analysis of 18 studies. So what it showed was a moderate to large hypnoanalgesic effect. A lot of the studies focus on the severity of pain, and hypnotic analgesia has been used for a long time, really, among hypnotists. Even long before studies were published, it's been used as a source of pain relief. But it is nice to see the results clinically. And hypnotic suggestion will be equally effective in reducing both clinical and experimental pain, even across those 18 studies. So I know the previous one was just one study and it was a small cohort of children, but it is a scientifically proven treatment for migraine. And there's more proof if you need it. There's a clinical psychology research criteria for being a well-established and effective treatment. And there's no side effects. And that's the good thing, because people often ask, when they haven't been for hypnosis, they'll ask, well, will I be able to drive afterwards? Or will I feel dizzy afterwards? Or are there any negative side effects? And the reality is there aren't. It's very relaxing for most people. And as I said, you don't need to be relaxed, but you'll usually experience things like heaviness of your arms, tingles in your hands, your face, lightness. And some people occasionally feel as if they're moving out of their body, which can be quite a trip. And I thought we'd look at some case studies. And the first few I'll show you are quite old, but I've broken them up into two areas here. First, female, because it affects more females. And then in a little while, then we look at, I emailed 2 of my clients yesterday, 2 male clients, and asked them for if I could have permission to use their case studies as well. And we'll go through their case studies. They were very happy to share. So on the first slide that follows there, you'll see this lady was in her late 40s and had chronic migraine. Now, if I remember rightly, her migraines were maybe with 20 days every month. They were really, it was facial pain that she really was presenting most with, and it was like having several toothaches at once, if you can imagine, which if you have had migraines, you can imagine, whether it's at the back of your head, the side of your head, your face, or wherever it is. And her triggers. Now with hypnosis, we would always look at what are the triggers, and it's very easy to manipulate those triggers with hypnosis. So she would have been eating a lot of chocolate, I do remember that, and her anxiety levels were severe. There was one particular situation that was really bothering this lady as well, and her perception of it was that it was completely overwhelming. So when we dealt with that, her stress levels came way down, and she took action to alleviate the stress around it. Not always possible to do that, but in this case it was certainly. And you can see there, week 6, with the sessions, what I normally do is 6 sessions over 6 weeks. And then you might never see somebody again, you might never need to. And then some people come back occasionally for whatever reason, sometimes because they like it, and sometimes because they have very, very, very stressful lives. And it's just to keep them on track. So her anxiety levels there went down to a 0 out of 10. She was so relaxed and so happy. Vast improvement in her ability to accept other people's reactions to the situation that she had been in. And that really was a lot of the cause of her anxiety. And the facial pain was gone, and occasional twinge. She also, because of the sugar cravings, we did deal with that, and she stopped eating chocolate. There was an increase in energy levels, and she had a host of she really saw vast improvements really, really quickly. And then the next lady then was in her 60s, and hers was episodic migraine. I was trying to give a few different types of case studies, because a lot of the time they're quite similar. Medication, I remember her GP giving her medication to start the same day as she did the hypnosis. So it would have been quite difficult then to decide which was medication, which was the hypnosis that was helping. But her previous medication, certainly, she found it, because a lot of the medication would be heavy duty, as you know. So she really didn't like the side effects, fainting, rash, and there were other side effects as well. She had never used hypnosis before, like a lot of people who use hypnosis for migraine. So it is a bit of a leap into the unknown. But here we can see day 1, what we looked at, what were her triggers. And she was drinking very, very little water. So we decided, okay, here's one of our goals. Let's get you drinking more water, get your sleep patterns normalized. Her sleep was very erratic. If I remember, it's sometimes too little, sometimes too much, and it was very broken. There were also hormonal triggers as well. Even within 2 weeks, her sleep patterns had vastly improved and stress levels were down. And stress is so easy to work with when you use hypnosis. It's one of the first things that people would notice about the progression that they make. Now, she did say that her appetite had increased. I have no idea why, but it had, because we didn't give suggestions to increase the appetite. But sometimes the brain works in mysterious ways. So we addressed that and it decreased. So in session 4, it had gone back down again to normal level. And there was, when they were able to get back to sleep, or when she was able to get back to sleep, she was obviously getting more rest. She had more energy. She was able to cope better with day-to-day activities too. And day 35 there, she had migraine, but severity had decreased. But her migraines were also much fewer. So I think you'll understand yourself that when you get control over your migraines, you feel a bit more in control of day-to-day things. You can go to social events, you can even plan for them is much easier as well. And on the next case study then, this lady was in the medical field, and they all gave me permission to share these, but I do remember her being a little bit reluctant even but really open-minded at the same time. And she quite hesitant to go into trance and to address the whole idea of the mind and migraines. But we established, first of all, it was menstrual related migraine. And we did an initial consultation in the office, and then we did phone sessions. So you can see that it works equally well on the phone. And her triggers were fasting, dehydration, hormone stress, chocolate. And process was very straightforward, just increase the water intake. Her job was extremely busy. So it was a matter of making it a priority and having the mind be like little Woody Woodpecker in the background going, okay, take time to eat, take time to drink water. And then you can see day 3, no migraine, and it normally would have occurred. Day 6, no migraines over the 6-week period, and cognitive changes. Really where hypnosis is very powerful is in changing somebody's thinking. And when you change your thinking, then behaviors change. And then migraines change. So I'm sure you're wondering how on earth all of that is happening and how somebody's words can simply change your physiology, essentially, and the effects that migraines are having on you. So we go on to the next one there. And if we look at the biopsychosocial model of pain and how now we understand that it's not just about injury to tissue, it's not just about intensity of pain, that pain really is affected by the environment, by our thinking. And when you look at those things, and we look at how hypnosis changes thinking, it can really influence pain management, and it puts the person back in control. The other thing is that it's clinically proven, and a lot of the research, as I said earlier, is looking at before and after the effect on the migraines. And more recently, it's looking at what is happening in the brain physiologically. And we know that it is changing the brain physiologically because we can see in a functional MRI scan the changes that are happening. And one study, I don't think I have it up here, but it's worth mentioning, there's a study done in 2011 for lower back pain patients, and they were able to give suggestions in trance and out of trance. Nussbaum and et al. Was the study. And the patients with back pain were given direct suggestions, which an example would be, you're finding that your back is far more comfortable now. And an indirect suggestion might be something to the effect of, you might find that you relax now or you relax later. And when they give both suggestions, direct and indirect, to people in trance and out of trance, they found that there was a 65% drop in pain intensity in the hypnosis group, and there was a 20% drop in pain intensity in those that were in the waking state when they heard the same suggestions, exact same suggestions. And then they looked at the brain scan because they were interested, obviously, in seeing what was going on. And they found that there was a cognitive behavioral network that was activated in the waking state, and a more emotionally weighted network that was activated in the hypnosis state. So very different brain areas activated but with the same suggestions, just a different state. And it had a different effect on the pain intensity then. You can also see patient satisfaction because there's no negative side effects, and you may find that it complements the medication you're on, or you may find that you don't need the medication anymore. Better quality of life, and that is measurable as well. And it would be measured the first session, the last session, if you're going in for hypnosis. A lot of people will say they notice a difference even after the first session. Not everybody, because nothing works for everybody, but certainly a lot of people would say that immediately they can feel a difference. And it is quite cost effective in the long run because you're not on medication, hopefully, for the rest of your life. And this is how it works as well. It's going to work, the suggestions that are given in trance can be analgesic, so they can be for pain relief. And we know from the brain scans as well that when you give a pain relief suggestion in trance, a part of the brain called the somatosensory cortex is going to, the activity is going to change in that area of the brain. So the suggestions themselves are really, really important. It'll also change our cognition and our thinking. So when people are stressed, then they often find that the reaction to something is, I can't deal with this, or I don't feel in control, or, similar thoughts. We can change those thoughts really, really easily in trance just by giving suggestions. Affective refers to the emotions. And we know that when we give emotional suggestions in trance, that a part of the brain called the anterior cingulate cortex, the activity in that part of the brain will change. And then you'll see behavioral changes follow on from those changes. So it's simple enough, and it is about addressing the right areas for that person and for each individual, because people are different and they have different situations going on. The environment is going to have an impact. So by combining all of these different suggestions related to the analgesic, cognitive, affective, and behavioral areas, you should see good results. And stress, of course, is the biggest trigger for migraines, as you all know. And with stress, the serotonin levels will drop, or can drop. And when that happens, that can lead on to a migraine directly. Same with low blood sugar levels too. So what if we, rather than try and alter the serotonin levels, we peel it back a few layers and we start to address the stress in the first place, so that serotonin levels are left as they should be and the stress is managed much better. And the stress really is perception about events that are going on. So suggestions to deal with that can be really supportive, and it's almost magical the way it can change within a couple of days, where you can see someone comes back after a week and they suddenly find, oh, nothing bothered me, or that there was no stress at work. Now, there probably was, but it's just that they weren't reacting to it the same way they normally would. So that's stress. Now, another thing that comes up sometimes is the confusion between placebo and hypnosis. So it isn't a placebo. It works differently from placebo. And there's quite a few studies investigating this question, I guess, that comes up. Both are very powerful and both work. But what we know from a study, well, a few studies that have used naloxone will reverse pain relief. And in the studies, in the few studies, some of them are in the Lancet if anybody's interested in looking them up, they found that if you give naloxone to somebody who's had hypnotically induced pain relief, it won't reverse the pain relief for them. But if you give the placebo group naloxone, the pain relief is reversed. So what we've come to understand is that the placebo will work on an opioid system, but we don't believe that the hypnosis does work on that same system. So while they're both very effective and really useful, they are quite different. And this was a study, well, there's two studies that we're looking at, placebo and the mind, really. This is nothing to do with hypnosis, but I just thought it was interesting to see that 6 to 8 milligrams of a hidden dose of morphine corresponded with, sorry, that slide is actually incorrectly written. There was 6 to 8 milligrams of morphine that was given when the patient didn't know when it was going to be delivered, was comparable with 6 to 8 milligrams of a saline solution, which the patients knew they were going to receive, but they thought it was morphine. And it was only when the morphine went up to 12 milligrams that really more significant pain relief was noticeable. So that's the power of the mind and the power of placebo as well. Now, I'm sure you are well informed about the facts, and I guess this is the global look at headache disability, and 500,000 people more perhaps are affected by migraine in Ireland alone, and it is significant cost to the economy. And if we go, I looked at the US as well, and of course bigger population, bigger costs, but really on a day-to-day basis for people, it really can be quite expensive as well to deal with and can cause a lot of disability. And on the next slide there, thanks, Deirdre, pain catastrophizing. What I would often look at with migraine patients would be pain catastrophizing and headache disability, because yes, it has a global impact on society in terms of costs to employers and to the employees as well. But on an individual level, what I would see headache disability as, it can be functional and it can be emotional. So functionally, it's what can you do? Do you find it difficult to read books? Do you find it difficult to socialize? Do you find it difficult to make plans, even to go on holidays? And pain catastrophizing is all about the cognitive and emotional response to pain. And to provide there, as you can see, by magnification of pain, helplessness, rumination. And if we can change that, which we can, you'll see with hypnosis, then the headache disability will change as well. And why look at catastrophizing at all? Well, there's a strong correlation between catastrophizing and disability, and that is independent of the severity of the catastrophizing. Also, there's impaired functioning and quality of. You can completely understand that, because when you can't think straight, it's very hard to get anything done. And catastrophizing will stay stable unless some kind of intervention is employed, whether it's CBT or hypnosis or whatever is your preferred option. There's also statistics to show that people who catastrophize will have longer hospitalizations, higher rates of healthcare use, and so on. So it's something useful to look at. Now, these gentlemen, I emailed them literally yesterday and asked them, do you mind, because they were more recent studies, and I thought they were quite different. So the first one there is a gentleman in his late 30s. They both had quite senior jobs. This gentleman has significant responsibility and he was on Effexor. He had constant migraine and was really despairing. So day one, I think he was very open to hypnosis, definitely. And that was helped, in fact, because the referring consultant was very familiar with the work that has been done with hypnosis and migraines, and I've worked a lot with his patients. So I think that helped too. And what we looked at was, he tried everything. He was suffering for years, the poor man, but we tried looking at, or we did look at, what was his life like overall? What was the big picture? And why was the pain getting to him so much? It was significant, but it wasn't the most severe type of pain that you might see. And I showed him this slide and he came back to me, and I'll briefly read his email if you don't mind, the comments he made, because I thought it was nice. He describes it better than I have there on the slide. He said, looking back with a degree of objectivity at my thoughts around the time of the 6th session, I think the most important change was that my perception of the pain, stroke discomfort, and my relationship to it had quite altered, and had altered significantly. The pain, while still present occasionally, felt less encompassing, less sinister. Spaces were beginning to appear through which normal life could flow again. The visual metaphor of the glass jars with differing levels of liquid was particularly relevant to this time. I've been continuing to use the tapes and I'm getting on really well. A night and day difference. I still have some discomfort at times, but there are days when I don't even notice the pain. And he's managing much better, and his lifestyle has changed considerably. And that's really the aim of it, isn't it? Is that you can start living your life the way you want to live it. I don't know if he's still on medication or not. I forgot to ask him, but certainly he can see a change in his thinking. The next gentleman then has a very high level job, also a lot of responsibility, and his migraine was constant, one of the worst cases that I've ever come across. And his job had changed, as many people have, and still are changed. It was a hybrid model where he was at home, he was at work, in the office some of the time. He's a very, very busy family life, and his food plan was completely erratic. There was no structure whatsoever. His sleep was pretty awful, probably because of the migraines, and the stress was enormous. I felt so sorry for the man. I met him the first day in the office, and then we did the rest of the sessions on the phone because he lives quite a distance away. He wasn't exercising either. And within a couple of weeks, he could see he was eating properly, sleeping well. Sleep is probably the first thing that I tend to look at when working with somebody and using hypnosis with them. And of course, when sleep improves, a lot of other things will fall into place. He said he felt more in control of the situation, and you can see he wrote down a few thoughts. I thought, I have control over them now. And he keeps in touch regularly. I would probably do a session with him once every 6 weeks or once every month. And he feels that just keeps him on track. And he's doing really, really well. There was one point, I don't think he'll mind me saying this, there was one point where he had a dip. And I said, are you listening to your MP3s? Are you eating properly? And he said, no. And I think that can happen too. We can get quite comfortable where we think, oh, everything's sorted, and we'll just take our foot off the pedal. But really, there is a maintenance level in it. And with migraines, I think it's important just to get the sleep patterns right and to keep them right as well. And of course, you know, the stages of migraine. The reason I put this up was because if we can stop it before the first stage at all, and some people won't experience that prodrome stage or that aura stage, but if we can stop it by managing the stress, and then it doesn't lead on. So very simplified. Yes, help. We can use so many different things. We can look at the triggers if there are any. And you can use medication, you can use hypnosis, you can look at foods. Most people who would come for hypnosis, I do find that they've probably ruled out all of those things by the time they might say, yes, bright lights affect them, or stress is affecting them, or it's rare that foods will. I do understand some foods will trigger migraine for people because of tyramine or tryptophan, or so even particular foods that we mightn't necessarily associate as triggering migraine. And if there's a belief system there that they are triggering it, and there is a reason why, or even if there isn't an obvious reason why, we can still address it with hypnosis too. So there's a lot of choice out there. So I guess what I'm saying is hypnosis is not for everybody, but certainly it's a nice tool to have, and it's a nice option to have as well, and puts people back in control. This was a study I did years back, and what we did was give, I recorded some MP3s. I wrote and recorded hypnosis MP3s and gave them to a group, and the group were randomized. So some people received the MP3s and some people didn't. And kindly, the participants filled in the questionnaires every single week, both groups. And the group that didn't get the MP3s at the beginning, they got them at the end. So it was great because you could see the results were really quite significant. This was week 1 to week 10. And this pain catastrophizing, if you remember pain catastrophizing, and if you're not familiar with it, the rumination and exaggeration of thoughts and so on, and the way the thoughts can take over sometimes when we're stressed or when we're suffering with migraine. It was a 60% drop in that time. And when in the next slide, you'll see that the headache disability dropped. 48% drop in headache disability. And really what people were saying afterwards was that they found that they could, again, do more. They could go out more. They weren't bothered by their migraines, and often would just forget they even had migraines until they got the next one. But the time period as well between migraines was longer, and the duration of the migraines was shorter. That was the study in a nutshell. It's nice to be able to summarize it in a couple of minutes.